Thank you so much, Chairwoman Brownlee. One of the bills we're discussing today is H.R. 3693, the VA CPE Modernization Act, which I am proud to co-lead with the chair. And I'd like to take a moment to thank Chairwoman Brownlee for her leadership on this bill. It is especially important to me, both as a 24-year military veteran and as a doctor, to provide more resources to those who are tirelessly working to care for our nation's veterans and who want their professional education continued. Our bill would increase the professional education allowance for VA healthcare professionals for the first time in 30 years. This bill would increase the amount provided to physicians and dentists at the VA from $1,000 to $4,000 per year, and would provide, for the first time, $2,000 per year to nurses, psychologists, physicians assistants, and other types of clinicians at the VA. This common sense bill would ensure that all clinical employees at the VA facilities are able to continue their professional education. And as we know, this is also one of the continuing education is also necessary for relicensure. It's one of my top priorities to care for our veterans and ensure that they have the best treatment possible, not just now, but also for the future. I would also like to take a quick moment to thank Representative Banks and Pappas for introducing the National Green Alert Act, which I proudly co-sponsor. The National Green Alert Act would raise an awareness similar to the Amber and Silver alerts if a veteran with a mental illness has gone missing. I support this bill. I passed one similar one in the state Senate in Iowa, and I encourage all my colleagues to do the same. It's interesting listening to this conversation about the VA workforce and bringing on individuals. And so, Mr. Perry, I have the unique skill set, if you will, as being a doctor, to have actually applied for a job at the VA 6 years ago when I ended my work as the director of the Iowa Department of Public Health. And so when you're talking about onboarding, expediting that process, streamlining the process of hiring, I will let you know that in applying for that job through USA.jobs.gov, that I was already 6 months into another job by the time I even heard back that I was being considered for the job at one of the VA hospitals as an ophthalmologist. There were several of them. So to hear that right now that you're starting the clock in advance of the actual negotiation process and that it's 51 days to hire, that's certainly much more in alignment, because I can tell you as physicians, they're not going to wait 6 months, much less 3 months, to hear back from you if they're even eligible for a position. And I was applying not only as a doctor, and there were several ophthalmology positions opening, I was also applying as a military veteran. So I'm going to say thank you for that. You also mentioned in your testimony that the VA CPE Modernization Act would help address clinical mission critical shortages. And I just wanted you to, if you could explain how the bill would do that.
Thank you, Congressman, for your comments and your questions. First, let me state that we have come a long way, I think, in our recruitment. And I'm certainly apologetic to hear that it was your experience when trying to come work for us. I hate to hear that from anyone, especially a valued clinician. So thank you for going through that. With respect to the question you asked, I think we recognize, as long as you, that CPE is actually a powerful recruitment and retention tool. And we think that this expansion will actually help us in that area and bring us more into alignment with what private sector does for their CPA and their clinicians. So we're excited for this piece of legislation. We think it's going to make a tremendous difference, not only in our recruitment, but more important in our retention. As you stated, we know that it is much easier to retain than it is to hire and bring people in the door. So we're looking forward to this increased flexibility to do exactly that, help with not only our recruitment on the front end, but also the retention and the professional development of our workforce, because we know also that a better educated workforce is going to give us better outcomes and better delivery of patient care.
In that same vein, do you think that it will also improve the quality of the clinicians that you can both recruit and retain?
Yes, ma'am, we do, because I think by expanding the cost that we can cover, it will lead to, I think, hopefully additional CPE that an individual can take, and not just be limited to a very small threshold. And that we know the cost for professional training continues to increase along with everything else. So we absolutely do believe that it will lead to a better professional and better educated workforce.
Thank you so much, Mr. Perry. And thank you, Chairwoman Brownlee. I yield back my time.
Thank you, Congresswoman, and thank you for partnering with me on this bill. I think you're the best partner I could possibly have on it, given your background, and I think it's an important bill. And I can tell you that for years the VA has testified in our committee saying that this program needs to be looked at. The capping of the fees right now never cover the costs. People don't utilize it because of that. And in terms of retainment, the VA has overwhelmingly testified that they believe improvement in this program will help in recruitment and retainment. So thank you very much.